proceed.
Question number 12, Dr. Carlos Chong.
Thank you, Mr. Speaker. My question is to Minister for Mental Health. What recent announcements has he made on rolling out new mental health services in emergency departments?
Mr. Speaker.
The Honourable Matt Doocey.
Thank you, Mr. Speaker. Our mental health plan is focused on delivering results, faster access to support, more frontline workers and a better crisis response. Recently, I announced the introduction of peer support workers in North Shore Emergency Department, completing the rollout of the service across all three major Auckland hospitals, alongside Dunedin, Christchurch, Wellington and Waikato hospitals. For anyone in mental health crisis, arriving as a busy emergency department can be overwhelming. Having a peer support specialist who understands what they're going through can make a real difference. No matter where you live, this government is committed to ensuring that timely support is there.
Supplementary. Why are peer support workers part of government plans to improve crisis response in mental health?
Mr. Speaker, I've always been open that one of the biggest barriers to timely mental health support in New Zealand is too many workforce vacancies. Peer support specialists are available to listen, share their experience and provide timely support. They can also link people to community mental health services, resulting in better outcomes once they leave hospital. Whether your child, a friend or a family member is reaching out for support, we're committed to ensuring support is there.
Supplementary. What feedback has the Minister received about the impact of peer support workers?
Mr. Speaker, one of my top priorities is strengthening prevention and early intervention. The feedback from hospitals with peer support workers has been very positive. A peer support worker in Wellington told me how surreal it was to be helping others in the same emergency department they came through in crisis a few years earlier. In Dunedin, a former patient told me on the worst day of her life, this is exactly the type of service she wishes she had when she was struggling. To deliver a better crisis response, we want to ensure there is someone to call, somewhere to respond and somewhere to go.
Supplementary. Where else are peer support workers being used to improve mental health services?
Mr. Speaker, our mental health plan is working. We are delivering, reducing wait times and increasing the workforce. Since coming into government, the peer support lived experience workforce has grown by almost 100%. Not only are we rolling out peer support workers in emergency departments, but also in crisis recovery cafes, eating disorder services and to help young people with FASD. When someone takes a step of reaching out for support, workforce should never be a barrier.
Supplementary question, Hana Rāwhiti Maipi Clark.
Supplementary. Will the Minister investigate the mental health crisis in Thames following a serious mental health incident that was brought to his attention by a local mental health rangatira in Hauraki earlier this Monday?
Mr. Speaker, I think it's always important that we respond to people who lay some serious concerns about the mental health system. As the Mental Health Minister, how I hold myself to account, and this government does, is setting New Zealand's first mental health targets. For the first time in New Zealand, we can use the data to go into communities around New Zealand and understand the level of access to those timely support. That will get rid of the postcode lottery for mental health in New Zealand.
Supplementary. How will his new announcements on mental health services address the lack of coordination and unwillingness of public services and agencies in Hauraki to intervene in serious incidents?
Well, Mr. Speaker, that member raises a significant point. New Zealanders' experience traditionally of the mental health system is one of fragmentation, and actually it takes too long to be seen. That's why this function of this government is to join up the mental health system and provide faster access to support. That is why we are now able to go back to the 20 health districts, understand the performance of each of those areas and ensure they deliver a level of services Kiwis should expect in mental health. 1 week for primary mental health and addiction support, 3 weeks for specialist mental health and addiction support.
That concludes oral questions. As members, a point of order, the Honourable David Seymour.